From the Evening Standard in London, this is The Leader.
Okay, so needle scratch.
Well, could injections like this be happening in GP surgeries around the country, around the world, maybe even starting before the end of the year? We have an announcement that's achingly close to the one we've all been hoping for. A frontrunner in the global race to secure a coronavirus vaccine has been found to be more than 90% effective at preventing the disease. But when can we get it? How do we get it? If it really does work, how hard will it be getting it to everyone? Professor Karol Sikora, a former director of the World Health Organization's cancer program, knows an awful lot about those questions, and he's with me now. Karol, first of all, Pfizer and BioNTech are making this vaccine. They're calling it a great day for science and humanity. Now, is that true, or are they overstating it a bit?
I think it's a little bit of an overstatement, but the pharma industry loves to blow its own trumpet, and it's a reasonable assumption. Here you are at the cusp of the launch of a vaccine that's causing, hopefully, a solution to the biggest public health problem I've certainly seen as a practicing doctor. There's been nothing like it in my career. And hopefully this can help it come to an end.
So this is what they're announcing here, the results of phase 3. They've tested it on nearly 44,000 people. But the testing doesn't stop here at phase 3, does it? What happens next?
What happens, it goes into practice. Every patient is monitored, not patient, these are just clients that are getting the vaccine are monitored closely. Any side effects are noted, and it's really important to keep that data. How we select the patients is going to be up to individual purchasers, individual governments. And the logical way is to do frontline health staff to start with, and then the most vulnerable groups, the over 80s, and then to work downwards and to keep it. The university students wait to the end of the line, if you like. They won't be too pleased about that. But maybe the medical students will be allowed to get it first. But no, seriously, the important thing is that you have a priority order, because you can't do everyone in the first week. It's going to take 2 or 3 months before it really rolls out in any large amounts. Remember, it's not approved. It's just the data look good. That's all that's been released.
Yeah, and they have warned that the efficacy could change. They may find other side effects. But at this late stage, in your experience, do things go wrong at this point?
I think it's likely this is going to work. The drawbacks of this vaccine, which is quite elegant, it's using RNA, made RNA, genetic information, which is injected into a muscle just by injection, intramuscular injection, and our own muscle cells make viral proteins. So we all know the spike protein, the little bobs on the Sputnik-like molecule children can draw and so on. So it's against the spikes. And that spike protein is going to be made by humans when this has been injected. The downside is that the RNA, the structure that's being injected, needs to be kept very cold, -70, -80 degrees. So you haven't got anything like that in your household fridge, nor has your GP in his surgery. And whilst it's relatively easy to solve in the UK or a rich country, if you're in a poor, hot country, Southern Africa, for example, Sub-Saharan Africa, it becomes really difficult to keep that cold chain, especially in rural areas. There are no fridges, and these deep fridges are very expensive.
So Pfizer are talking about being able to supply 50 million doses by the end of this year, 1.3 billion by the end of 2021. Is that it then? Is coronavirus done? Are we all going to be able to just rush out and get our vaccine?
The problem will be that some people won't become immune, but hopefully they'll be protected by those that are, this concept of herd immunity or collective immunity. And once you get a reasonable proportion, 60 to 70% of the population immune, whether it's due to infection by the virus or it's due to vaccination, then the virus has nowhere to run and it stops and the pandemic is over. So there's no doubt it is a great day in terms of the vaccine works, and it's going to be a great tool to reduce it. We're still going to have problems, but we're going to get out of them probably faster with the vaccine than we would have done without the vaccine.
Professor Karol Sikora there. Now, Here's another moment Downing Street's been waiting for: the US President-elect to call the Prime Minister, but it appears Boris Johnson is some way down Joe Biden's list. Our political editor Joe Murphy is with me now. And Joe, is that call coming soon?
Well, I can tell you, David, that the phone call hasn't happened yet, and my sources at Number 10 are telling me not to expect it to happen today at all. Mr. Biden is busy drawing up executive orders to try and undo the Trump legacy, and so he's probably not going to get round to it. But the big question is definitely, will he ring Mr. Johnson at the same time, or in Boris Johnson's dreams ahead of those other big European leaders like Angela Merkel and Emmanuel Macron?
And of course there is some history between Joe Biden and Barack Obama with Boris Johnson, and it's not all been plain sailing, has it, Joe?
I remember like yesterday that amazing day when Barack Obama came over to London in the middle of the Brexit referendum battle. And he had a very productive meeting with David Cameron, and he said that Britain would be going to the back of the queue if there was a trade deal to be done, because the trade deal between America and the EU would take priority. And Boris Johnson, who replied at the time, he said he thought that the president's part Kenyan ancestry may be influencing his stance, making him slightly anti-British. Now, Barack Obama was furious at that, not surprisingly, because it sort of implied that his policies were driven by his colour and family history. And Joe Biden has clearly shown through colleagues that he feels that that was very off-colour. However, there's a big difference. Joe Biden wasn't president at the time, he is now. And Boris Johnson wasn't prime minister at the time, and he is now. And when these guys do meet, they'll be meeting as president and prime minister of two countries that have always had a very close partnership on a series of issues, and Britain has always striven to try and keep the relationship as special as it can be. None of those things are going to change with the change of president. The transactional foreign affairs relationship will exist.
Ultimately, does it really matter when Joe Biden phones Boris Johnson? Does it make a difference if it's below Germany, ahead of France, behind Greece or wherever? Is it actually that important?
Well, a senior Number 10 official said to me this morning, you guys are going to get excited about this, meaning you guys in the media, but really we're not that excited about it. His point is that Number 10 regards the substance of the relationship as the most important thing, and there's plenty of grounds for a substantial relationship. Climate change, Britain's chairmanship of the COP26, for example, will be one of the big first international meetings next year that will allow Biden to take his place on the world stage, and Britain's organising it. So that's a useful sort of step. But it does matter in terms of perceptions, and if the perception is that Britain has lost some of its influence because of Brexit, which in the US's eyes it has, because the US always saw Britain as a bridge to the United States of Europe. We can't be a bridge when we don't actually land between the two countries anymore. So perceptions matter in politics, and if Mr. Johnson is seen to have lost his edge, that will be remembered.
You can read more about these stories in the Evening Standard and at standard.co.uk. The Leader podcast is back tomorrow.